So abdominal trauma, it can be of two types: penetrating abdominal trauma or the blunt abdominal trauma. In penetrating trauma, the abdominal pain, bleeding, shock, or evisceration of organ can be seen. And most common injured organ in the penetrating abdominal trauma is liver. While in blunt trauma, abdominal pain, distension of the abdomen, then unexplained shock or discoloration on the abdomen can be seen. And the most affected organ in the blunt trauma is the spleen. So during the examination of the person with the abdominal trauma, first of all, note all the wounds and abrasions. Then palpate the abdomen for any localized or diffuse tenderness. If diffuse severe tenderness is present, then it is a sign of internal bleeding. Then also look for any kind of internal injuries, for example, to the liver, spleen, or kidney. So in blunt trauma, the different signs which are seen can be the Cullen sign, which is seen in hemoperitoneum or severe pancreatitis, that is the bluish discoloration near the umbilicus. Then Gray Turner sign is seen, which can be seen in hemorrhagic pancreatitis or retroperitoneal hematoma. Then Kehr's sign is seen, which is mostly seen during the splenic injury or any kind of intra-abdominal bleeding. Then the various diaphragmatic injuries are also seen. So on the left side of the diaphragm, if any injury is there, then there are less chances of getting diaphragmatic hernia because of the liver, while on the right side there are more chances for the injury, or for more chances of the hernia on the right side. And now the in management of abdominal trauma, first of all, primary survey is done, in which the A, B, C, D, E are evaluated. Airway with the cervical spine precautions, that if there is any kind of cervical injury or not. Then the breathing, circulation, then disability, and the exposure of the patient is done. Then once the primary, and during the primary survey, the emergency care is also taken, the IV fluids are given, then external bleeding is controlled, the dressing of wounds is done, and also protect the organs with the eviscerated organs, which were eviscerated are also protected with the sterile dressing. Then stabilize the patient, then give high flow oxygen if required, and keep the patient warm, and provide analgesics as required. Then during the secondary survey, all the general and systemic examination is done, and special attention is given to the like any axilla, perineum, or back pain is there, or any sign is seen there. Then the Foley's catheter is seen or monitored to monitor the urine output of the patient, and if there is any bleeding or not in urine also seen. Then a nasogastric tube is also put on the patient. Then during secondary survey, once the patient is stabilized, then the history of allergy or any past medication history, or any or when the last meal was done, or what was the event during the injury. Then later on, the investigations are done. In blunt trauma, if the patient is hemodynamically stable, then the investigation of choice is CECT, and if patient is unstable, then it is FAST. FAST is focused assessment sonogram in trauma. Then if the patient has a penetrating injury, and if it is superficial to peritoneum, then the investigation of choice is CECT, and if there is peritoneal breach is present, that is peritonitis is present, bile staining of dressing is seen, then go for laparotomy.